Hello, everyone. Welcome. Today, we're continuing with our interview series, and I'm here with Dr. Mary Simon, and she is a naturopathic doctor at Thrive Holistic Medicine. So, Mary, for our listeners today, can you just go over what naturopathic medicine is
Hello,
and what
everyone.
the principles are?
Today, we're continuing with our
We got
interview.
some feedback.
I'm sorry, I was trying to share it and I got the feedback from the Facebook page. Can you ask the question again?
Sure. First, just tell us about naturopathic medicine, what it is, and what the principles are.
Great. So, naturopathic medicine is a whole body form of medicine where we look at all aspects of your health. So, with naturopathic medicine, we have 6 key principles that we follow. So, first is to do no harm. As a naturopathic doctor, I want to make sure any options that I'm giving my patients are not only safe, but also effective for what we're dealing with. The second principle is to identify and treat the causes. With whole body ways of healing, you have to look at every aspect of the patient, because if we merely give a pill for an ill, we're not going to really get to the root cause of it. So I like to use an analogy for this one. Let's say you have the trash in the kitchen and maybe a week goes by and you don't take it out. What might start happening?
Well, it really starts to stink, that's for
Starts
sure.
to stink, yep. So first we could get out our essential oils, and we could be diffusing essential oils all day and all night. And it can help mask or manage the smell, but we still didn't actually take the trash out. So maybe a few more days go by, and what starts to happen next? Maybe some flies.
Yeah.
Yeah, so
Yeah.
next we could get our fly swatter out. Bam, 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 we're getting the flies. We have our essential oils going. We're taking care of the smell, but we still didn't take the trash out. A few more days go by, maybe you get bugs. You can pull out your bug spray. You have your fly swatter. You have your essential oils. So at the end of the day, if we're only looking at signs and symptoms, we're not addressing the cause of the problem, and the body is going to keep finding ways to express itself. The body has an unlimited amount of ways that it can show signs and symptoms of disease. And really, signs and symptoms are your body's warning signal telling you, hey, pay attention, something has to change. Now, what do you have to change? As a naturopathic doctor, I can really help get to the cause of it quickly so that you don't play an endless guessing game. So that's the second principle. Then number 3, we like to treat the whole person. So oftentimes, or sometimes I should say, I get patients in my door who say, I only want help with my high blood pressure. Well, unfortunately, the body doesn't work that way because everything is connected. And when we look at whole body health, I can find out the common themes with every disease or ailment that the person is facing and really fix things from the ground up. Small changes in certain areas of the body can have effects throughout the entire body. So that's number 3. And then number 4 is the healing power of nature. Nature has given us an overabundance of everything we need to be well. So with nature's healing power, we can use things like hydrotherapy or homeopathy or herbs, nutrition. And instead of sitting at home Googling for hours on end and coming up with a list of, let's say, 30 different things you need to be taking, like 30 supplements, I can really help streamline the process so we can give you the minimum amount of things to make the maximum amount of difference for your individual case. The number 5 is doctor as teacher. Docere is the term in Latin. So docere is doctor means teacher. As a naturopathic doctor, it is my duty to really teach you what is going on with your body and what does it mean. Like, why are you having signs and symptoms and ailments in the first place? Then number 6 is prevention. I like to use another analogy for prevention. So let's say we're going to shoot a bow and an arrow, and our target is 30 yards down the way. If we make a really small 1-degree change in the present, so let's say now this analogy to your health, let's say we do one small lifestyle intervention that you're going to repeat day after day after day. Well, today, tomorrow, 5 days from now, there might not be a big difference, but shooting a bow and arrow, a 1-degree difference here means the difference of being on track versus off track 30 years down the road. And same thing with your health. It's the cumulative effect, the snowball effect of doing a dietary or lifestyle intervention day after day after day that will really be the difference of aging gracefully and feeling well overall versus feeling like crap, not having energy, not having great moods, and just suffering overall. So those are the principles of naturopathic medicine.
That's wonderful. I really love naturopathic medicine, and a lot of the principles overlap with chiropractic and the philosophy of chiropractic as well. Finding that root cause, having true prevention, not just covering up symptoms, and really teaching patients how to live a wellness-based lifestyle to have them live their best life. It's wonderful. It's definitely, in my opinion, the best approach to health and wellness. And it's
It really
really
is,
great.
because it gives the patient their power back. You don't have to be a victim of the circumstances or what's happening to you. You can really take control of your health and change your health for the better. And natural health practitioners like chiropractors and naturopathic doctors like you and I, we can really help patients unlock their body's healing potential.
Yeah, absolutely. And then I find with chiropractic care, the adjustment is a passive therapy. So it's something I do, but then the body takes it the way the body takes it.
Mhm.
So I find that if someone isn't responding in the way that I expect, I might recommend supplements, lifestyle changes, but also there are times that there's so much going on that I will refer patients to you because you have more tools than I have in that realm. So tell us about what type of tools you use and where you start with someone when they come into your office.
Yes, that's a great question. So what I already described was the principles of naturopathic medicine, and I always start out with that so that the patient knows where I'm coming from when I'm trying to make recommendations. Now, the second part, instead of our principles and the philosophy, it goes into what's called the therapeutic order of naturopathic medicine. And I'm going to tell you exactly where chiropractic care fits in that therapeutic order. So I have a guide here. I'll just put it in front of the camera. Hopefully people can see, so you have a little bit of framework as I talk through this without having a handout. Let's see if I can do this. Okay, there we go. So there are 7 levels to our therapeutic order. Level 1 is the base and the foundation. We absolutely always have to create the conditions for health to exist. And we do this through what we call the determinants of health. What is literally determining your health? It's things like nutrition, hydration, fresh air, sunlight, supportive relationships, potentially looking at genetic factors or environmental factors. So, focusing on the determinants of health, we have to do this every single day. Proper nutrition, fresh air, sunlight, movement, supportive relationships. So we always have to look at level 1, the base, the foundation. Then as we go up, level 2 would entail things that a lot of people call our energy type medicines. And on level 2, we're focusing on unlocking your body's own healing potential. Your body knows how to heal. It knows how to be well. And what we have to do sometimes is just give it a little oomph, a little push in the right direction. So on level 2 would be therapies like homeopathy, hydrotherapy, acupuncture, Reiki, energy medicine, meditation. Aromatherapy might fit into this level, certain forms of massage therapy. So it's very gentle therapies that have low potential for side effects, but can have a really drastic difference in just supporting your body with its own efforts. Then as we move up, level 3 is where supplements start to come into play. There are specific nutrients and specific herbs that have affinities for specific areas of the body. So for example, if somebody is dealing with high stress and their adrenal glands need support, because their adrenal glands help produce cortisol, which is a stress hormone, I might use an herb like ashwagandha. Or if somebody has issues with their liver or maybe high cholesterol, we just need to support that aspect of their body, the liver. We could use an herb like dandelion. So with level 3, we're not looking at specific biochemical reactions. It's more of a nutritive and tonifying effect. Then level 4, as we move up, level 4 is to address the structural integrity of the body. So level 4 is where chiropractic comes into play. If you have a structural issue, we need to fix the structure, because no supplement in the world will take away the structural problem. Maybe it would help with pain and that sort of thing, but it won't actually correct the structure. So I often refer people to chiropractors. Physical therapy also fits into level 4, certain forms of massage therapy. And it's, again, just focusing on the structure. Structure can determine function. Then level 5 is the top of what I do. And even before I became a naturopathic doctor, but I was signed up for the program, what I thought naturopathic medicine is what I'm going to describe as level 5. Essentially, it's swapping out a pharmaceutical for an herb. But again, if all we're doing is swapping one for one all day long, sure, it can help. You can feel better, probably less side effects than the pharmaceutical alone, but we're still totally ignoring the fact that your body was having these signs and symptoms in the first place for a reason. So if we're only looking at level 5, it's something that you'll have to do again and again, over and over for the rest of your life. Whereas we have to remember everything below, especially level 1, which is creating the conditions for health to exist. So I'm almost done with the therapeutic order here. There's 2 more levels. Level 6 is pharmaceuticals, so giving something that's going to palliate, make you feel better. So pharmaceuticals, there is a time and a place for everything. I'm glad level 6 is there. But in our world, we use level 6 way too often. Most prescriptions are prescribed for chronic diseases that have lifestyle factors directly related to them. And then level 7 is the top, and that is surgery, high force interventions. Again, there's a time and a place for surgery as well. And if, for example, if somebody's in a traumatic car accident, yes, get them the best surgeon, give them the best medications and anesthesia to get through the surgery. But as a naturopathic doctor, I'll probably say, let's do an anti-inflammatory diet. Let's take some arnica as a homeopathic. Those are levels 1, 2. Level 3, we can give the body some herbs to support the musculoskeletal system. Definitely see a chiropractor as well. So again, there's a time and a place for everything, and any level can be used at any time.
Absolutely. What a great way to lay that out. And as you're going through it, I'm realizing that most Americans jump to level 6 and 7 without trying those other levels first. So what brings people to you to try something different?
Yes. So most people jump to level 6 and 7 because they don't know what they don't know. They go to their doctor, and their doctor, with all of the caring, love, and attention and tools that they've been given in conventional medicine, say, here's the treatment, it's a pharmaceutical, that's all you can do. Well, let me tell you, your doctor doesn't know what they don't know. And as a naturopathic doctor, I've really been trained in all of the healing modalities in addition to knowing the conventional medical standards of care. So I have people coming to me who find me through a variety of sources. So some patients are just really proactive and they know that they don't want medications, so they seek out other options from the get-go, which is great. It's amazing. I have other patients who have really been through conventional medicine, seeing specialist after specialist, doctor after doctor, getting medication after medication, and they still don't feel well. And they're so frustrated because they say, how can I be doing all of these things? I'm doing everything my doctor tells me to. I'm taking the medications they're telling me to take, but I still feel like crap. And I get this all the time. Most patients will break down crying in their first visit with me because they're so frustrated. And a lot of times they see me as a last resort. So what I do there is I say, first, we just have to figure out what your body is telling us and go from there. There are certain conditions that I see more often, like gut health, hormone health, that I do advanced lab testing, which conventional medical doctors usually they do standard blood tests, urine tests, maybe a stool test here and there. But with functional medicine testing, we can go much deeper and really get to the cause more quickly.
Awesome. Yeah, I can definitely identify with people crying in the first appointment.
Yeah.
I see that all the time too, and it breaks my heart that people have gotten to that point where they don't know what else to do and they feel so lost. And I'm glad that people are finding you, and I think that that's becoming a new movement in our society, and I sure hope so that it continues that way. So I just do want to say quick for those of you watching, if you have any questions, please post them in the comments, and there might be a little bit of a delay, but I'll see them and we'll be able to get to your questions at the end. All right, so next, I was hoping you'd be able to tell me about a big win that has happened in your practice.
There are so many. I'm trying to think where to start. I think overall a blanket theme of a big win is finally giving a patient answers for a question they've had for years. Sometimes I have people who come into my office who have literally been struggling for 10, 20, 30 years of their life, and they still have a glimmer of hope that things can get better because they're in my office. I mean, if you had absolutely no hope that anything could get better, you wouldn't be seeking out care. So again, if I do advanced functional testing over and over again, I get people answers that they've been looking for a long time. And when we have those answers, when we have documentation of what exactly is going on, and we can use our therapeutic order very specifically for their case, they get well quickly. So one condition that I see a lot, it's called a small intestinal bacterial overgrowth. The abbreviation is SIBO, S-I-B-O. And with SIBO is the cause of about half the cases of irritable bowel syndrome, IBS. But one aspect of SIBO can be chronic constipation. So quite often I have people in my office who are chronically constipated. Maybe they can only go to the bathroom like once a week, once every 10 days. And they've been to GI doctor after GI doctor. And it's a relatively new or up and coming diagnosis per se. Like there's more research being done on it now, and doctors are just now becoming more familiar. But when we do the breath test for it and they have an answer and I know exactly how to help them, it's such a relief. So giving patients answers is a huge win. Another win would be I see a lot of patients with mental, emotional health issues. So depression, anxiety, PTSD, maybe like ADD, ADHD. And sometimes there's a common theme of a history of emotional abuse or other forms of abuse. And the beauty of naturopathic medicine is that homeopathy is one of our modalities. When I give somebody the correct homeopathic remedy for the way that they feel and experience their mental emotional health issues and or physical symptoms, it can be a drastic night and day difference of helping to rewrite these negative thought patterns and the negative self-talk that people deal with on a daily basis. Even myself, like personally, I have negative thought patterns that I'm working on overcoming, and it's amazing that you can reprogram the brain and reprogram your mind so that you can take control over the thoughts and the feelings that you experience every single day, while you can heal from those emotional traumas and feel better overall.
Awesome. That's so great. I love that. And I think that's a pretty common thing to struggle with. Our negative thought patterns do get ingrained in our mind, and we create these pathways that are difficult to break up.
Yeah.
I want to go back just a minute, and you mentioned a breath test for the SIBO. So I just want to clarify for our listeners, do they have to give a stool sample, or is this just a machine that you breathe into?
It's a breath test. So for SIBO, we don't do a stool sample. That's not the way to diagnose it, because a stool test looks more at your large intestine or your colon function, whereas SIBO is in the small intestine. So it's a hydrogen and methane breath test. And it's a kit they would take home, and they would collect a sample every 20 minutes for about 3 hours. And the sample would measure the amount of hydrogen and methane. Hydrogen is produced by certain bacteria that should not be in the small intestine. Then the methane is produced by a bacteria that will feed on the hydrogen, and that's the type that makes people chronically constipated. So it's a breath test they do at home, and then they mail it into the lab, and the lab sends me the results.
Cool. So this is not invasive or scary or gross or hard at all. This is a simple test that they just do at home.
Yeah, exactly. It's very simple, non-invasive. There's no pokes, and they do it from the privacy and comfort of their own home.
Wonderful. That's a huge plus for any test, I think.
Yeah, definitely. It is. It takes away one obstacle for sure.
Mm-hmm. Great. All right. So one question I've been asking people is that with the Safer at Home order, our lives have completely changed. Things are totally different.
Yep.
So tell us what you and your family has been doing during this time to support your health and well-being.
First and foremost, hand washing is extremely important. And even when I come home from work, I will just go straight in the shower, put my laundry straight in the washing machine in case I was exposed during the day, so that we can not infect my whole family with it. So hand washing is really important. Then supplement-wise, some of the typical immune boosting supplements like ACEs and zinc, so vitamin A, C, E, and zinc. Then elderberry syrup is an antiviral natural substance. So elderberry syrup is something that I give my daughter. I get a form called immunoberry because it also has medicinal mushrooms that'll support your body's own natural healing abilities. And then in other countries, I'm part of the Illinois Homeopathic Medical Association, and they put out some resources of homeopathic prophylaxis being used in other countries, because homeopathy is the #1 form of medicine worldwide outside of the US. And there are certain remedies that it seems like the coronavirus responds well to specific homeopathic remedies. So I've ordered them. They're not very common ones. I've ordered them, and as soon as I get them in, we're going to start some protocols that way. I'm trying to think what else. Those are really the big ones. And one thing that I like to tell patients is, even if you're exposed, it's not a death sentence. For a lot of people, COVID-19 is a very minor illness. And also, if you get an illness and you do absolutely nothing versus if you get an illness and you do natural therapies to help support your body through it, there's different outcomes there, right? So you're not hopeless or helpless at any point, especially when using natural therapies, because you can support the body. There are hospitals in New York and other countries that are doing high dose vitamin C on patients who have coronavirus, and they're getting really great results, along with a few pharmaceutical medications at the same time. So when you give the body the right conditions, your body can heal and it can overcome and it can become stronger.
Awesome. Yeah, and I've seen the vitamin C studies as well, and I always have to giggle to myself because I'm like, yes, but it's not new. We've been doing that for a long time for all viruses. It's
Yeah.
just when we have no other treatments, that's when we default to that, which is
Yeah,
a whole other discussion.
exactly. And for people with financial means and resources, there are clinics in the area that will give you IV nutrients. You just pay out of pocket for it. So I went last time, maybe about 2 weeks ago. So I got zinc, vitamin C, glutathione, a few other vitamins intravenously, just as a preventative measure.
Yeah.
I don't know what places are open right now because of the stay-at-home orders. Some might be, some might not be, but it is one intervention that can be done preventatively as well.
Yeah. Yeah, so that's what we've been doing in our home. We take our regular multivitamins and probiotics, and then also I added Immuneplex, which is a standard process product that is
Mm-hmm.
ACE and zinc, and elderberry. But I haven't heard of the one with the mushrooms. I was perusing some supplements, which the immune boosting supplements right now they're all on back order.
I know.
But I just happen
Vitamin
to
C
have
especially, it's hard to
Mhm.
find. I know I have some orders coming in. Hopefully it'll show up again soon. But yeah.
Well, and I keep getting the emails that the supplement companies are working around the clock, and that's what they're working to produce, but there's a huge demand. So
Mhm.
I would say if people want it, they need to order now.
Exactly.
And hope it comes in. Yeah. So any other recommendations or anything else you want to talk about?
Trying to think. Well, I do have 2 free resources that I would like to share. So a big part of my practice, as I mentioned a little bit earlier, is mental emotional health, and it's really a passion of mine. I also see a lot of gut health and hormone health too. But I am doing a free masterclass this week, Friday at noon, and it's going to be all online, so digital. You can do it from your pajamas laying in bed if you want. So if you would like to attend virtually, please send me a message. I will link our business page in the comments of the video. And then also the second resource that I would also send you with that is a totally free 1 week meal plan. And the meal plan is aimed at eating for happiness. So foods that are really going to drive your neurotransmitter production and help boost your mood, reduce your anxiety overall, because food is really powerful. When you give the body the building blocks for health, your body knows what to do with it and it'll help. So I have those 2 free giveaways. I would love to see people attend the live event on Friday. And that event is emotional stability and happiness. So again, we're going to talk about the nutrition aspect behind mental health. We'll also talk about some other things to consider. For example, causes of depression that could be like your thyroid or your adrenal glands need some extra support. So there are other causes besides just feeling depressed. And then also tips to start to rework those negative thought patterns, just actionable tools that you can implement right away. I would love to see everyone attend. Again, I'll post the business page in the comments, and then I'll reach out and send you the free giveaway and the link to the event on Friday as well.
That's so great. I'm just going to put it on the bottom here so that people can see it.
Oh, perfect. Oh, and then also one more thing I wanted to say. I offer a free 15-minute discovery call. So if you're considering naturopathic medicine or this has really intrigued you and put a little bug in your ear about, wow, maybe there's something else I can be doing for my health issue, please reach out and we'll chat on the phone for 15 minutes where you can tell me everything you have going on health-wise, maybe how many providers you've seen in the past, what they've said, any medications, that sort of thing. And then I can give you an idea of what it would look like to work with me. What are some of my thoughts right off the bat of what we might explore further, including maybe the lab testing aspect or approximately the cost of establishing and maintaining care for the first 3 months. So you have an idea of how often you would be coming in for office visits. And I also do appointments virtually over the telephone or through a HIPAA compliant video chat platform. So I'm seeing patients still, even now, virtually, and I would be happy to connect with anyone that way as well.
Awesome. So what's the best way to get a hold of you? Is it through your website, email, Facebook?
Any of the above. You could definitely send me a message through Facebook. Probably the fastest way that you would hear back would be sending us a text message. Our phone number is 414-278-8922. I can also post that in the comments. And then I know our website is scrolling on the bottom here, so www.thriveholisticmed.com. And through our online website, you can book appointments online as well. So if it's the middle of the night and you decide you're ready, you got to get this done now, no problem. 24/7, you can always book online.
That's so great. Yeah, we have that on our website as well. And it is funny. I'll get like in the morning, I'll see a notification someone booked at 2 a.m. I'm like, yeah, it was a rough night.
I think about half of the online bookings come through between like 11 p.m. and 5 a.m. It's really amazing.
Yeah. Awesome. So this has been great. I know I'm gonna definitely try to be there on Friday for that class. Um, it's kind of dependent on my 3 crazy kids running around, but as long as you can't hear them, I will probably be there.
Yeah, and also you can always watch the replay of it too. So
Right.
if you can't make it right at noon, you can always check it later. If you start at noon but have to hop off, you can always listen to the rest later as well.
Okay, awesome. And then I'll have you send me the information for that, and I will email it out to the people who are on my email list. So those of you listening, if you're on my email list, you'll see that come through um, this afternoon. All right.
Thank
Well,
you.
thank
Thank you
you
so
so.
much.
You're welcome. Thank you so much for taking some time out of your day to chat with us and give us an overview of naturopathic medicine and why it's so wonderful. I love it. It's great. And we'll have you back sometime, chat about emotional health and maybe some other topics as well.
That would be great. Thank you so much. I really appreciate it. Thank you for sending out my link to your patients as well. And like I said, if anyone wants to chat for 15 minutes, can give me a call, send me a text. We'll put you on my schedule and we can really see if it would be a good fit to work together.
Great. All right. We'll talk soon.
Great. Have a great day.
Bye.
Bye.